It gives me great joy to introduce our next speaker. It's Dr. Pratik Choudhary. Dr. Choudhary is a professor and a consultant endocrinologist at Leicester Diabetes Clinic, University of Leicester in England. He is confined only to treating type 1 diabetes, so he's a highly specialized person. He had his MD subject as continuous glucose monitoring, and he spent 15 years at King's College London training. And he's also the co-lead of UK insulin pump project. And he brings a unique confluence of education, psychology, and technology in the field of type 1 diabetes. So I'm delighted to introduce Dr. Choudhary and wait to listen to his beautiful words of wisdom. Dr. Choudhary.
Thank you, Namaskar. And I just hope get my slides over. So I think it's very hard to follow those three talks, Swamiji, with the introduction on yoga, Surabhi, with that really personal story of diabetes and how it affects people, and of course Srikanta ji with that beautiful interplay of science and religion. So what oops, Anjali, do I have to do anything to share the screen or my slides? Thank you. Is it? Sorry. I will just. There we go. So it was my pleasure and privilege, really, to visit the hospital in Haridwar with years ago, and meet the Dia champs really out there. And the thing that struck me when I met them is I've worked for 50 years in one type 1 clinics in the world at King's, and we have access to pumps and sensors and all the technology and all the latest gadgets and things. But when we asked these people in the room what their glucose levels or what their control was, it was better than the control of the people we see who have access to everything. And when you looked at the faces and how they're interacting with their diabetes, how they're coping with their diabetes, what their identity is with their diabetes, again, it was much stronger. They were much happier than a lot of the people I see. And I think it's not due to anything else but the love and kindness of Swamiji and the way he's built this community of people together. And I saw this poster made by a class 5th girl, Kashish Chaudhary, class 5th child. And it really touched my heart because, you've got the story of the child who is labeled as someone with type 1 diabetes, someone who's different. Maybe and the children are playing and nahi hum tumko apne saath nahi khelne denge, tumko diabetes hai. And it just highlights what this little child was feeling about how the diabetes had affected them. And I slide of Google, and what it showed, even the person might have a calm exterior. If they have diabetes, there's so many things going on in there. What they eat, did they have the right insulin, what's their blood sugar, what's going to happen in the long term. If they meet someone, what will that, as Surbi said, what will the other person's reaction be? That this person has diabetes, will I get a job, will I get married? There are so many things that go on that mind that really have a big impact. And it's not surprising actually that, so in literature, we calling this distress. And the distress, upset, all the things you have to do, you have to prick your finger, you have to insulin, you have to think of your food, do your exercise. Now, of course, all of us have anxiety in other areas as well. It might be financial anxiety, social anxiety, what's going to happen with my job, what's going to happen with my education, what's going to happen with my relationships with other people. And these things can layer over. And when you have other things going not so well in your life, maybe, the push comes onto the diabetes. That can lead to depression. And we know that people with diabetes are about 4 or 5 times more likely than the background population to feel depressed, often because of all these things that are going along. And so whenever we see this, one of this story of integrated approach is firstly recognizing that now people who we look after with type 1 diabetes, these are more common. And instead of just chasing down what's your blood sugar level? Did you get your injection? Did you check your glucose on your finger? Looking at their mental health, looking at the emotional health, and having strategies in place to help that is really important. Because it could be the person is upset because they have got high HbA1c, sugar control is not good, and they don't know how to get it right. And that is a lack of education, lack of teams, that is a lack of maybe the tools, the equipment, the straight. Maybe they have got, after having diabetes for a long time, I see a lot of people with 30, 40, 50 years of type 1 diabetes. And they say, every day I want a couple of days off when I don't have to do all these things. Or people who are still not accepting, I want to pretend I don't have diabetes. And on the other hand, you have, as I said, people have things happening in work or at school. And when that goes wrong and your mood is down, then you don't want to do the things, you don't want to do the diabetes care that you normally do. And then there's this constant fear of weight gain, fear of complications, fear of failure, fear of not getting all the sugars right. All these things play in the mind. And so that's where there's a real space and role, and not just in centers dedicated to yoga like the Ramakrishna Mission, but also here in the West, that that how can we address this mental unease that happens with diabetes? How can we calm this down? Because it's important to treat that mental health, and if that has some beneficial effects on the physical health, that is a bonus actually. And so you talk about integrating mind and body. And so in simple words, you've got the person with the little diabetes in the middle. It's as people who give diabetes care and are responsible in some positions nationally in the UK. We have to make sure that every child, every person who lives with type 1 diabetes has access to the right education, how to use the insulin, how to carbohydrate count, how to adjust the insulin for their food, for their work, for their exercise, so they can do whatever they want to do to the full of their ability. I have patients who are professional football players, professional rugby players, people who are welders, people who are doing shift work, people who are doing heavy manual labor, people who are sportsmen doing athletics. And it's the role of the doctor to have enough knowledge that they can give to the patient without education. That perfect care team who wraps around the patient, not just looking at the sugars, but also looking at the emotional health. And the top side there, you also need to be able to provide equipment. It's not having someone who wants to do well, but then the patient doesn't have access to the strips and access to the technology. And it was lovely to see the project in Bangalore around automated pancreas project. But the reality is, even in the UK, access to that sort of technology is limited by cost. Its cost is about 5 lakh rupees a year. And really, even in the UK, in the healthcare system, people can't afford that because you still need the pump and the sensor to run that algorithm. And then finally, of course, you need to have that way when the mind is a bit upset. How can you calm it down, bring things together? Because if the mind is, as we say in Hindi, vichalit, upset, then you can't use the education properly. You can't access your team properly. You can't use your technology properly. So having a calm mind, balanced mind, is a key to make use of all these things. And that's, I think, what we all mean by that integrated approach to diabetes, bringing together the best of education, technology, and psychology to help our patients. So I had a small message. Thank you so much for the opportunity to speak to you. I'll be very happy to answer questions towards the end of the panel. Thank you.
Thank you, Dr. Choudhary. That was a beautiful exposition of the knowledge, the psychology, and the technology. And also, it was really great to see how you explored the pancreas and the mind connection, and how by actually controlling the mind, you also, to some extent, control diabetes, and the complications, especially in the mind, go beyond blood sugar and insulin. And therefore something for the mind, such as yoga, dhyana, pranayama, all those exercises